Did you know that there are warning signs of high blood pressure that you should pay attention to? Even though blood pressure is considered the silent killer or the silent disease, where most people do not have any symptoms at all until something fatal happened to them, like they have a heart attack or they have a stroke, or they go do a lab work and their kidney function is out of whack, and they realize that this is caused by blood pressure. However, your body has a way of telling you to pay attention to your blood pressure. Now, the normal blood pressure is defined by the American College of Family Physician as anywhere systolic over 140 or more, or diastolic over 90 or more. That means the upper number and the lower number, okay? And also the American Heart Association or College of Cardiology tell you a different number. They said 120 for the top number and 80 for the lower number. So if you have anything higher than that, then you should pay attention to your blood pressure. But the warning sign to the elderly people is that if you're an elderly person, your arteries become stiffer. So you need a little high pressure to push blood into your organs for perfusion. And so if you have a lower number, that might not be good for you. Okay, so that is just a tip I want to give you there. If you're an elderly person and you are dropping your blood pressure so low, it may not be healthy for you. Now, what are some of the warning signs that your body tells you that you need to pay attention to, that you need to watch your blood pressure? The first one, if you have frequent headaches, especially when you wake up in the mornings and mostly at the back of your head, you're having frequent headaches, that is a warning sign that you should pay attention to your blood pressure. The second thing is that if you're experiencing blurriness of vision, double vision, every now and then you're experiencing that, that is also another warning sign. If you're having dizziness, lightheadedness, these are all warning signs that your body is talking to you and you should pay attention. If you experience a nosebleed, now, not all nosebleed are from high blood pressure. Some of them could be just your capillaries are very dry in your nose, so they break and you bleed. Or if you are on a blood thinner, you're bleeding, that's different. But if out of the blue you have a nosebleed, it could be a sign that you are having blood pressure problem, especially if it happens every now and then. You should pay attention to your blood pressure. And another thing is shortness of breath. You walk a little bit and you feel short of breath. You have to stop and breathe. You can't climb a flight of stairs. Those are also signs telling you that you got to pay attention to your blood pressure. What about chest pain and irregular heartbeat? Every now and then you're experiencing chest pain, you're having irregular heartbeat every now and then, or you are having what we call fatigue, constant fatigue. These are signs that you could be having a high blood pressure. And if that happens to you, what should be your next step? If you're having some of these symptoms, the next step, what I'll tell you is that you should get a blood pressure cuff and measure your blood pressure and sit down quietly. Now, I have a video on this channel that shows you how to accurately and properly measure your blood pressure so you get a right number. Now, if the first number is high, don't panic. Don't panic. Measure it again. Do about 3 times, okay, as I show you on the video on my channel here. And record those numbers down. If they are high, the numbers that you are getting, they are high according to what I just gave you earlier definition, then the next step you want to do is to see a doctor to take the blood pressure for you. Now, one of the things that I've realized in my practice is that most patients come to the office and the nurses, the MAs, they take the blood pressure wrongly. And so they get a very, very high pressure as compared to what the patient took at home. When that happens, I use the patient's numbers to go if they really have high blood pressure or not. Now, if your pressure is just mildly elevated, there are things that you could do to reduce them. However, if you are getting pressures, the top number in the 180s and then bottom number over 110 and it's high and you're experiencing headache or chest pain, that is hypertensive crisis, all right, hypertensive urgency. And you should go to the emergency department immediately, or you should call 911 because you could be having a stroke, you could have a heart attack, or this could affect your kidneys or even your vision. So if those numbers are that high, don't stay at home. but go to the ER. Again, take the blood pressure about 3 times to make sure the numbers are consistently high, because sometimes taking it just the first time may not be accurate. Okay, from my experience. Okay, and also, what are the things you can do if you just have a little bit of a high blood pressure? Well, the first thing you want to do is lifestyle changes, because blood pressure is a lifestyle problem, and so lifestyle changes will can help you lower the blood pressure. What are some of the lifestyle changes you want to do? Exercising. If you are a couch potato, you want to start exercising regularly. And usually you don't have to go to the gym or walk on a treadmill. Those are vigorous things that you are not going to keep up with the rest of your life. There are certain things that you can do, like walking, brisk walking 5 times in a week, about 30 to 45 minutes at a time, sweat a little bit. Those will cause an increase in nitric oxide in your blood, and those would open up your vessels, and your blood pressure will fall. Okay, so walking is one. Number two, lose weight if you're overweight, because if you're overweight, you are requiring a lot of pressure to push the blood through your arteries, and so your blood pressure is high. So lose weight if you're overweight. If you have sleep apnea can be a reason for high blood pressure. So you should get treated for sleep apnea. Go and get a sleep test done so that we can treat your sleep apnea. The other thing you can do is dietary modification. Now, most people tell you that don't eat salt, low salt diet. That is not true, okay? Because the studies have shown that it's not a low salt diet that will cause your blood pressure to go high. Eat normal salt. Just don't over salt things, right? Don't overeat salt, because you need salt in your body. So don't do low salt diet. In fact, the studies are proving that low carb diet is actually better than the DASH diet that is recommended, by the American Association of Family Physicians. Actually, low carb diet has been shown to reduce metabolic syndrome and therefore reducing blood pressure better than the DASH diet. There have been several studies that have proven that. So if you go on a low carb diet, that would be a good thing for you as well. And another thing you want to do is to reduce stress. Okay, learn to reduce stress by meditating, by prayers, and by just taking some therapy. These will also reduce your blood pressure. And also, if you're smoking, you gotta quit smoking. Yes, buddy, you gotta quit smoking, because that affects your blood pressure. And also, excessive alcohol use will affect your blood pressure. If you're taking drugs, you need to stop doing all those drugs or heavy drugs. They can affect your blood pressure. So these are some of the things you can do if you notice that you have signs of high blood pressure, and you take the blood pressure and you notice that it's high. You can do some of these things to actually help you reduce your blood pressure. Now, if you've done all these and about 6 months down the road, your blood pressure is so high within the lifestyle modification, then it's time to see a physician, get a thorough checkup, and you might want to start you on one medication in addition to the lifestyle modification to help you control your blood pressure. So if this video has been helpful to you, I want you to subscribe to our channel, hit that button, the bell, and also give us a like and share this video with your friends, because it may save their lives. Now, if you've done any of these lifestyle changes and it's helped you, I want you to write in a comment below. Just share with our listeners, because somebody will benefit from this. Until then, this is Dr. Moses, and I'll see you on the next episode.